I'm Evan Parks, and I'm the author of the book, Chronic Pain Rehabilitation, active pain management that helps you get back to the life that you love. I'm here to answer your questions about pain. And in this session, we're going to be talking about a breathing strategy that can help manage pain. One of the first things that I begin with as I work with patients who have chronic pain is explaining the connection between the mind and the body and between the stress that we have and what happens to our body and what we can do to help manage that stress response. Our stress response increases muscle tension throughout the body. It also activates an immune response that can also lead to inflammation. So it's really important to figure out how do we turn off some of that chronic stress activity that's happening in our body because of chronic pain. Our autonomic nervous system, which is right here controlled back in the brainstem, has two divisions: a sympathetic, which speeds up activity throughout the body, and a parasympathetic that slows things down. The sympathetic increases heart rate, increases breathing, increases blood pressure, increases the amount of blood sugar that we have in our system, increases adrenaline and cortisol, and it changes circulation in the body so that our hands become cold, our feet become cold, and blood rushes away from those areas to the central muscles in the core of our body, getting us ready to fight, to flee, or to freeze, which means to hide. And we want to have a little bit of control over that system to help slow that down. Now, the autonomic nervous system, of course, is run automatically so that we don't have the kind of conscious control over it that we would like to have. But there is one element of that autonomic nervous system that we do have control over, and that is our breathing. So right now, you're probably breathing at about 12 breaths per minute. If you're under stress or under a pain flare-up, that breathing rate actually goes up 16, 18, 20 breaths per minute. And what we're going to do with this breathing exercise is slow that down to about 12, from 12 breaths per minute to 6 breaths per minute. So if you've ever been at a doctor's office and that doctor puts a cold stethoscope on your back, you've probably taken a deep breath like this. You go like that, and your chest goes out, your shoulders go up. When we practice this breathing exercise, I want you to change your thinking, that you're not going to be taking in a deep breath, you're going to be taking in a slow, quiet breath. And as you take in a slow, quiet breath, you're going to help calm down the nervous system. And this is how I teach it. We have a muscle under our lungs, and that muscle is called the diaphragm. And that diaphragm is not something that we can actually feel, but it helps us breathe correctly. And as that diaphragm pushes down, our stomach should go out. Our ribs aren't going to move, our shoulders aren't going to move. So if you see my hand here, as I breathe in slowly through the nose, stomach goes out. And as I breathe out through my mouth, I purse my lips a little bit. So there are three parts to this breathing exercise. First, I breathe in slowly through my nose on a count of 4. It goes like this. And then I breathe out slowly through my mouth on a count of 6. Then the third part is I slowly hold my breath empty right at the exhale. So I breathe in, I breathe out, and then as I exhale, and I finish the exhale after 6, I hold it for a count of 2. 1, 2. So I breathe in, 1, 2, 3, 4, out, 1, 2, 3, 4, 5, 6, and then I hold it for 2. 1, 2. You can do it with me now. Take a slow, quiet breath in through your nose. It's not a deep breath, a slow, quiet breath. It goes like this. Out. Pause. In. Out. Hold. That's it. Breathe in quietly through your nose, not a deep breath. If it's too deep, you're going to feel lightheaded. You're taking in too much air. It needs to be a slow, quiet breath, a sustained, slow, even breath out. That's why you purse your lips. And then you pause, just holding that empty breath for 2 counts. As you do that breathing rate, you take your breathing from 12 breaths per minute to 6 breaths per minute. And that actually is a signal to your parasympathetic nervous system that says to your autonomic nervous system, hey, things are okay, things are calm. And it begins to put a brake on that accelerated sympathetic system that just was speeding things up, preparing you for action. And so one of the benefits that you're going to experience from this is your hands and your feet are going to become warmer as circulation goes back to those areas of your body, as that sympathetic system starts slowing down. Your heart rate is going to go down. Your blood pressure is going to normalize. And those things are going to be helpful to you to feel healthier and be healthier. So to learn more about this, go to my podcast called Pain Rehab Podcast. You can find it on any platform, Apple, Spotify, Google, anything. And you can also look onto my website, painrehabsource.com. If you have questions, let me know through the Contact Me section of the painrehabsource.com website, and I will be looking forward to hearing from you. I look forward to talking to you again soon. Take care.